The number of families requiring assistance from ComCare, a government financial aid scheme, has hit a 5-year low in 2024. The Social and Family Development Ministry's annual report on lower-income household trends says the decline since 2020 reflects economic growth, labour market expansion, and increased support from other schemes. ComCare, which provides basic living assistance to lower-income families, has 3 types of schemes. Short to medium-term assistance provides temporary financial relief for basic needs, while those who are permanently unable to work and lack family support can apply for long-term assistance. Families can also receive student care fee assistance for their children. Now, the report shows that the number of families who required SMTA continued to decline, and some 20,800 households were on the scheme in 2024. That's a 9% fall from the 22,900 families in 2023. The latest figure is also 40% lower than 2020, when the COVID-19 pandemic was ongoing. Now, the median sum of monthly payout that each SMTA beneficiary receives was increased to $380 last year, up from about $370 in 2023. The exact amount varies depending on income needs and household composition. Regular reviews are conducted to ensure rates keep pace with the cost of living. Now, the report also shows fewer families returning for help after exiting the scheme. Less than half of the families returned within 2 or 3 years of leaving, roughly a 5 percentage point drop from the 2020 cohort. Those who came back often did so within the first year, a period which MSF says is when families remain the most vulnerable.
Most of those who have exited SMTA is due to new employment, and with new jobs, it's always come with a set of new challenges. Some of these families, they do not clear their job probation period, and as a result, they lose their job and they have to return to seek financial assistance. There are also other factors such as debt struggles and also medical conditions and mental health issues.
The number of households receiving long-term assistance also declined by around 7% to about 3,200. And MSF says this may reflect more residents working longer years, higher levels of savings, as well as the expansion of social support for seniors.
Being in a crisis situation or needing help at some point of your life can be situational and not permanent. So a little help actually goes a long way for families who choose to seek help and to do so early, such that they work closely with help agencies such as SSO to actually improve their overall situation and achieve certain uplift.
Around 4 in 10 lower-income families do not hold stable employment, a figure that has stayed the same in 2024 compared to 2023. But at the same time, those reaching social mobility, meaning a stable job, no major assistance, and had higher incomes, also grew slightly. These families are under the ComLink Plus scheme, aimed at improving social mobility in areas like income, education, and housing through financial incentives and other social support. Chloe Teo with the details.
Mr. Muhammad Saleh is the sole breadwinner of his family of 5. He is also a part-time caregiver to his daughter with special needs, a feat made even more impressive by the fact that Mr. Muhammad Saleh is a cancer survivor.
If I'm not working, then I have to have a lot of support. But now I'm working. I'm still working. But I still sick also. Because after this cancer, I got high cholesterol. And my leg all pain already. But I have to work for them.
His family's story is one of resilience. But like many other families, they needed a helping hand in their journey to social mobility. This is where ComLink Plus comes in. Under the scheme, a family coach has helped to navigate the various health and financial schemes available, amongst other things. He also receives additional monetary aid from the ComLink Plus Progress Package that incentivizes continued employment. Around 40% of ComLink Plus families face challenges with employment, often for similar reasons like health issues or caregiving responsibilities. One social service agency says these barriers often limit the choices available to such individuals to more accessible work, such as retail or food services.
However, these jobs can also be quite physically demanding or have long hours, which makes caregiving a challenge or maybe takes a toll on their physical and mental health. All of this may make our clients appear very picky or chasing convenience when they're actually just trying to make ends meet.
He hopes more firms can offer support and flexibility beyond just placements, as a stable job is often the first step to breaking a cycle of dependency.
When there is finally some form of job stability, then our families can move beyond thinking of day-to-day survival. Yeah. And it's not just because income has increased. In particular, it's because their cognitive bandwidth has increased significantly. They finally have the time and the space, both emotionally and mentally, to start planning ahead in the long term, in fact, not just for their future, but for their children, especially if they have a target ahead of them, like moving into a purchase flat.
More families also became homeowners in 2024, moving away from HDB rental flats. This is up from 2% in 2023.
And for more on this, we speak to Dr. Wong Chin Yi, who is Research Fellow at IPS Social Lab at NUS. And he joins us on Zoom from Taipei. Dr. Wong, great to have you with us. Now, overall, do these findings indicate that lower income families are resilient and also showing signs of being more socially mobile?
I would say yes. On the whole, we do see encouraging trends of resilience and upward movement, and this is especially on the job and income front. In fact, when we look at annualized increases in per capita household income over the last 5 years, we observe that income growth is actually strongest for households in the bottom 20%, and this actually outpaces the median. And on a similar note, I think we've also heard that the number of households that are seeking financial assistance through the ComCare schemes has also been going down over the years, with a lower proportion of households returning to seek assistance after exiting the scheme as well. But at the same time, resilience can be quite uneven across Singapore households. So a subset of households may actually face intersecting barriers such as caregiving demands, family instability, or chronic health conditions. And they may actually need a longer runway of support to translate stability into mobility. In other words, we will say that there's been some real progress that we see for Singaporean families, but mobility can also still be very challenging for families that are dealing with multiple stresses as well.
Yeah, and picking up on those challenges as well, we've seen earlier that there are many factors that contributed to this downward trend of families receiving ComCare. But what more can be done to ensure that this trajectory continues so that families can become more independent?
I would say that what can be done it's actually a whole of society kind of approach. So a lot of the more encouraging signs that we see with ComCare, with ComLink Plus, these are actually very, very promising early trends. Over the years, it will give us the opportunity for social mobility to progress further. And I would say that in terms of social mobility, we also have to be a little bit more patient on that front. So in terms of mobility, a lot of the more longer term outcomes are actually intergenerational in nature. And I would say that another important point here is that companies, employers can actually do a fair bit more, because one of the best ways, as we've heard, of supporting these families is actually through stable and sustainable work and not just financial help. So many companies do already provide significant support through donations, through various programs, but the next frontier is arguably on the job itself. For instance, through flexible scheduling for employees who are caregivers, or clearer progression pathways for low-wage workers, which help them to sustain in their employment and not just get hired.
Yeah, we're also seeing here that there are some households that exit and then they re-enter government assistance. How can we help these people to eventually be less dependent on the scheme? What kind of challenges do they likely face?
I would say we should start by understanding some of the family circumstances that these households face. So as flagged in the report, there are certain kind of household demographics, certain profiles that are more vulnerable to re-entry to government assistance. So for instance, families with young children and lower educational attainment, they're actually more vulnerable to returning to assistance. And this sort of reflects how quickly finances can tip when income is unstable. So re-entry into assistance is perhaps best understood as a matter of fragile family finances. Many families exit when things improve. For example, a job is found or income becomes more stable. But that stability can still be very thin, especially in the early months. So as mentioned just now, the data shows that if households do return to assistance, it tends to happen within 12 months of exit. And this is where the vulnerable households, such as those with young children or health constraints, they face more instability. And a single disruption at that point in time, such as a major illness or job loss, can undo that progress quickly. So re-entry is often a matter of family circumstances and stresses that may be more strenuous in the short run. And I would say that we need to pay more attention to these families in the shorter term. They may need a longer runway or closer follow-through during that post-exit period before their circumstances can really stabilize.
Yeah, and speaking of these families who face a lot of these stresses, we've seen earlier just now the story of Mr. Mohammed Saleh. He's faced multiple challenges that could also jeopardize his employment. So how can we provide people like him a leg up? For example, can companies do more? You mentioned a whole of community approach earlier. How can we be of help?
So I would say for a segment of families, as we've seen just now, these stresses at home can actually undermine employment stability. So for some families, challenges in terms of family functioning are actually not trivial. They may face stress in the form of very heavy caregiving demands, as we have seen, and even instability or safety concerns. Family stress can disrupt daily routines and reliability, which are exactly what the employers look for, especially during the early period, such as probation. When families are managing crises at home, it can lead to unplanned absence, difficulties in concentrating on work or schedule disruptions. And even when a person is very motivated to work, it's just harder to be punctual, consistent, and mentally present at work. And over time, that can make it harder to clear probation, sustain employment, especially with certain low-income jobs that have less flexibility as well. So as mentioned earlier, employers can actually do more in the sense of providing more flexible scheduling for employees or clearer progression pathways. The report actually points to some existing community employer efforts that tackle barriers like caregiving and job retention. And the key may be to expand some of these efforts so that workplaces can be designed with employment stability in mind, with stable incomes, flexible hours, supervisors that are trained to work with and support struggling workers, and structured career progression. It becomes easier for our families to not just get a job, but also to sustain their employment as well.
Dr. Wong, thank you so much for sharing those insights with us. I've been chatting with Dr. Wong Chin Yi from the IPS Social Lab.